You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, the future of dentistry. With us, we have an expert on the topic, Dr. Sabine Purps. Dr. Purps, welcome to the program.
Hi.
Now, before we get into today's topic, for people that don't know you or your practice, tell me a little bit about your practice, who's your typical patient, and then also a little bit about your background.
Okay. I'm German.
Okay.
That's how I all started out. I started as a lab technician in Germany. And coming over here, I just had this vision that America is amazing and I want to do the German precision onto the American...
On the American way of doing it? You think it's a more precise possible, the way that you're doing it in Germany? Is it a different type of training or philosophy or approach?
The training is a little different. We have a little bit more hands-on. It's a 6-year program, and it's a lot of. We integrate a lot of fun in what we do. We have lab classes in the first 3 years, and then the other 3 years is pretty much with patients only. And then having my lab background, it's interesting because I know exactly what needs to come to the lab, what the lab sees, how the lab is. What makes the lab guy happy or not. Okay. And it kind of helps me on the other end, being in the chair with the patient, and the crowns just seem to fit a little easier. They go in smoother if I can provide the lab a really good model.
Mm-hmm. Okay, so tell me a little bit about what drives you, because you like talking about the future of patient care.
My drive really is to get up in the morning and being able to help patients, to be able to see those smiles coming into my office. And the most kick that we get out of in our whole team is patients that are super afraid in the beginning. We provided a really nice environment when we built our office, and it's just a very relaxed environment. Patients come in, they're easygoing. We do really slow interviews at first. We see what does the patient want. We ask a lot of questions. We're always trying to figure out what's really important to the patient. And that's why our approach is a little different. We don't just jump into treatment right away. It's a very slow process. I call it slow down to speed up.
Slow down to speed up, okay.
Slow down to speed up. That's just one of the easy ways to ease afraid patients into making sure that they have great oral health on the long run.
Okay, and so in this economy, some people say hectic times. What's the future? What's your prognosis for the future of dentistry?
Well, the future is that about 80% of the dental practices are going to end up in group practices, and that's great. It's access for a lot of patients, and it's a lot of a great service to the patients because there's surgeons and there's root canal specialists, and they're all in one building. I'm, on the other hand, I do strict helping patients to get to great oral health by getting great restorations restored, by getting old crowns out, by getting the cavities out. And we always look at the whole picture, where we're pretty much checking blood pressure. We see if there's any signs for a patient might be diabetic. There's a lot of systemic things going on with the patient. And the future really in my little world is that we're really taking care of every single patient. We know them first and last name. It's very individualized care. So
what do patients say? What's the feedback you hear from patients with the way you're practicing dentistry?
Patients are usually very surprised that we take that much time with them. That I'm a single practitioner, I have one hygienist, one assistant, and there's so much attention to detail. I'm always explaining what I do for the patients that like to know. I have some patients that are not interested in, like, just do it and be done and I'm out of here, which is fine with me as well. But just helping patients to understand where I'm coming from, and I'm always rolling out all the risks, benefits, and alternatives so patients know what the alternatives are. So it's a co-diagnosis. We're working together to find what's best for the patient. We're always making a big master plan, and many patients have never received a master plan from their dentist before, where we're just asking questions. How did you get to this point? What happened? Why is this tooth breaking? Sure, I can go in and fix it. Everybody can just fix it. But first we find out why it broke, because sometimes there might be a whole different reasoning behind why things break.
Okay, what are you doing to keep up with it all? Tell me a little bit about your continuing education.
I used to be a CE junkie, and it's just about 100 hours each year. We're supposed to do 50, but I'm now doing a little bit more about the psychology behind what's going on with helping patients to be less afraid. And I've taken classes out of Seattle. I've taken some Dawson. He's in Florida. There's so many classes out there that are high end. They're usually 3-4 dayers that I really enjoy. And lately we've been just really focusing on how can we help patients to be in a point where they understand this is what happens if I don't do anything, and how can we help them to have great oral health. It's more like a coaching that we do with patients.
All right, and so the team training, you also, I'm looking at my notes, big on team training. Elaborate on that.
Well, for us, communication is a big deal for patients, helping patients to understand where we're going. And with the team, with each other, we're a small team, but it's still, I'm coming from a background where I was in a group practice, and that dynamic is very interesting. You speak your future. You really want to be out there and help your team as a good leader. Okay. I'm learning leadership, ownership. Very interesting dynamic, stuff that I have never even heard of in dental school. That's way beyond the technical skills that makes me being a much smoother operator, because I don't have to deal with a lot of things that I used to deal with. There's the staff, we're all it's a blast going to work. Okay. And all those little things that happened in my old practice that distracted me from patient care are off the table now. And that's, for me,
Your old practice at where?
When I was in a group practice.
When you were in a group practice?
Yeah, we had 18 staff members, and just being a small group practice, a small practice without the, pressure of what we have to do. It's just fun. We see patients, we see their smiles, and it's just great.
Okay, good. Now, when you drive, I always ask people this sometimes, that when you were driving over here and we said, we're going to give you a 15-minute interview, a little bit about you, what was your main message? It's like, what do you want patients to know about you or your practice? Or, what was, when you're driving over here, you're saying, I want to make sure I get this message across. I want to give you a chance to say, okay, I had a chance. Randy didn't interrupt me. I got a chance to, give my approach, philosophy, or whatever.
Yeah. We work very different by getting the master plan to patient, by discussing the master plan with patients, by really helping patients understand what we do. I have not yet had a patient come back, well, the doctor told me I need this. It's usually the patient understands and helps me to really find the best thing, what's great for the patient, that helps to keep the teeth for the rest of their life. Okay. And that's a different approach instead of in and out. We're very personal. Patients always say, you're very detailed. You're so picky about what you do, and so into your flow. When you do what you do, we see you shine. Okay. And for me, having been a lab technician coming from the other end, it's just, when I wear my loupes, my 5x magnifiers, that's just the best thing, how I can provide the best restorations for the patients and help them to understand it's oral health, it's your whole body that we're helping you. And if I can help the patients to come in less, if I can provide the patient with great gum health, with great teeth that are, it's the whiteness of it is one thing and the cosmetic thing is one thing, but the function. Patients grind their teeth. Patients have so much stress in their lives that if they can come in and relax with us, we'll get an easy approach for patients, and that's just my juice. Okay, good. And final message, I guess, to anybody watching this, that wants to know more about you. They could go to your website, learn a little bit more. You're always accepting new patients. How do patients hear about you now? At this point, it's word of mouth only. Okay. We don't advertise. It's We ask for referrals. If we always like patients when they make a nice comment about, this is what I really like the way you were on time today. I really like the way you were just finishing on time. We're very respectful with that. And then, hey, we'd love to see your friends and family and treat them as our family. The patients are an extended family to us.
Okay, great. Well, I want to thank you for coming on the show. And they can visit your website. Your website is what?
www.sandiegofindentistry.com.
SanDiegoFineDentistry.com. Well, thanks again. We're going to take a quick break. I'm Randy Alvarez. We'll be right back.